Thank you. 3,800 people across Tennessee lost their lives to drug overdoses in 2022. The Northeast Tennessee Department of Health is providing naloxone for free at all of its local health departments. Here to tell us a little bit more about naloxone is the department's regional director, Dr. David Kirschke. Thanks so much for joining us today.
Hey, good to be here. Yeah.
Well, first off, let's just go back. What is an opioid?
Yeah, so opioids are pain medicines. Sometimes they're prescriptions, sometimes they're bought illegally, but things like oxycodone or fentanyl or heroin. They tend to, like, they're pain medicines, but also in an overdose, they can make you stop breathing. And that's what most people would die from an opioid overdose, is stop breathing.
And I know that you touched base on it a little bit, but what are some signs for somebody on the outside looking in to look for when it comes to an overdose?
Yeah, so if you think someone may have overdosed and they're unconscious, they're having trouble breathing, they may seem like they're asleep, but you can't wake them up, or they're having like gurgling, snorry sounds coming, and you can't get them to wake up.
And so I know that naloxone is life-saving. We've all been talking about it for quite some time now, but what is it and how exactly does it reverse these overdoses?
Yeah, so it's an FDA approved. It comes in a nasal spray form, so anyone can do it as long as you can go like that. You can give someone naloxone intranasally. But it basically reverses what the opioid does in the nervous system, and then allows you to start breathing again.
And about how fast can it work?
Yeah, it can act in 1 to 2 minutes after it's given.
And so obviously we know this is truly life-saving, so how can people get this?
Yeah, so the good news is it's available for free at all of our health departments, so you can go in any health department. It's also available at pharmacies, so some people might get a prescription for it when they get a prescription for an opioid. But anyone in the public can come get it at one of our health departments for free.
And I know that, overdoses, it's a hot topic right now. And what are some other preventative measures that can be taken to prevent them?
Yeah, so the main thing is drug treatment programs are important. Also, make sure if you have a prescription for an opioid that you keep it stored safely so that someone doesn't unintentionally or intentionally take it that shouldn't take it and potentially overdose. We do recommend anyone that might be in a position to reverse an opioid overdose, whether you know someone that does drugs, or even if you just have opioids in your house, or even if you just have a first aid kit, keep some naloxone in there because you never know when you're going to come across someone that needs to be revived.
And obviously, I know that you suggest keeping it on you. Does it expire? What are some tips that people need to know about it?
Yeah, it can expire. It's best to keep it at room temperature, but if you keep it in your car so that you always have it, or if you're a woman, keep it in your purse or in a backpack. Keep it at room temperature is the best, but just the most important thing is that you have it when you need it, which you never know when you might need it.
Absolutely. And if there's someone that is watching this that needs help, or maybe they know someone that needs help with substance use disorder, where can they go?
Yeah, so Tennessee Red Line is a good first place to go, and they can talk to you about referrals for treatment and things like that.
All right. Well, is there anything else you want folks to know about this, or how they need to get this naloxone?
No, really, just anybody that could be in a position to save someone's life that might be in an overdose should come to the health department if you don't already have a supply of naloxone, and get free naloxone.
All right. Well, Dr. Kirschke, always a pleasure. Thanks so much for joining us here on First at 4. Yeah.